Hello, welcome to my channel, 2 Minutes Concepts. I am Dr. Shoaib Mehsud. Today we will discuss about heart failure. So, what is actually a heart failure? It is a clinical condition characterized by the inability of the heart to pump blood in proportion with the requirements of the metabolic tissues of the body. It may be divided into systolic failure depending on whether there is abnormality in the cardiac contractility, as seen in ischemic heart disease, pressure or volume overload, dilated cardiac myopathy. Or diastolic failure when there is abnormality in the ventricular relaxation, as in constrictive pericarditis, myocardial fibrosis, or amyloid deposition. We can also classify heart failure as left ventricular failure or left-sided heart failure. It is most commonly caused by ischemic heart disease, hypertension, aortic or mitral valvular disease, and myocardial disease. Features of heart failure include hypertrophy and fibrosis in the myocardium associated with secondary involvement of the atria, which shows enlargement. Atrial involvement results in the development of the atrial fibrillation, which is responsible for thrombus formation or embolic stroke. The other organs affected include lungs. It is the most commonly affected organ. The increased pressure in the pulmonary vein causes pulmonary edema. The edema fluid accumulates in the alveolar space. There is leakage of hemosiderin and other iron-containing particles which are phagocytosed by macrophages. The iron gets convolute to hemosiderin, leading to formation of siderophages or heart failure cells. The alveolar fluid impairs gaseous exchange, giving rise to breathlessness or dyspnea, which is the earliest feature of left ventricular failure, orthopnea, which means dyspnea on lying down, and paroxysmal nocturnal dyspnea, meaning dyspnea at night. There is also presence of curly B lines on chest X-ray due to transudate in the interlobular space. Kidneys. In the early stages, decreased renal perfusion causes activation of the renin-angiotensin-aldosterone system. Whereas in the later stages, continued reduced renal perfusion may precipitate prerenal azotemia. Right ventricular failure or right-sided heart failure. Left ventricular failure is the most common cause of the right-sided heart failure, whereas pure right-sided failure is seen in chronic severe pulmonary hypertension and is called cor pulmonale. The features seen as a result of the inability of the right heart to pump blood in different organs include liver. There is presence of congestive hepatomegaly. In addition, if associated left ventricular failure is present, centrilobular necrosis is also seen, which is replaced by fibrotic tissue in long-standing cases and is known as cardiac sclerosis. Spleen. Congestive splenomegaly is seen. Kidney. These show the congestion resulting in severe azotemia. The congestion is more prominent in right ventricular failure than left ventricular failure. Pleural effusion, pericardial effusion, and ascites are also seen. The hallmark is peripheral edema of the dependent parts of body, particularly pedal and peritibial edema. Anasarca is the generalized massive edema seen in heart failure. I hope you have enjoyed this video. Please subscribe our channel to get more videos like this, and if you have any question you can ask in the comment section. Thanks for watching.